because you are in a place where more than 99% of humanity will never be on the verge of being a physician, if you think about it. Yeah. Yeah.
That was deep.
Pretty deep.
Foods and medicine, social media platform go like foods and medicine. It was, are you from LA? Sorry.
Born and raised in Sacramento, but I've spent more time
Sacramento.
in
So
LA.
you're in Cali, and I'm sure you know like the food means, like what's up, food, whatever, growing up. And we kind of, it's a little joke at first, but people that we want to get our message across to are gonna know what that means, and that's the people that we want to touch and inspire. If they see us being like, what's up for whatever, we were like, let's just do it. It sounds funny. Like people that we want to talk to, like little us is gonna know what that means, and we want to talk to them. And it's worked out.
That's perfect.
But we have a couple questions for you.
Okay.
It's okay. First one we have is, what does it mean for you to be the first Latino secretary?
It means I come and speak to you two because I know what it means to bring more people like us into the profession, so that there are people who care for us, who look like us, who sound like us, who know us, and therefore they'll ask the right questions, because you know that if you're the physician and you don't ask the right questions, you may not know how to treat that person properly. And if that person doesn't know how to answer your questions, they're not gonna get the best treatment. So being the secretary means I can make sure that we're doing everything we can to let everyone in America have access to the people that know them.
It means a lot to us that we do have, one of us in representing us, because we're like, there's a lot of us in this country, and I think the representation doesn't match that, so.
But the thank you really is to you, because you're the ones that are going to do this. I can try to enable it, but if you don't apply to medical school, then you're not there. And so, I can enable it, but you got to do it.
We got a lot of work to do, Irvin.
My question is, do you have any advice for any 25-year-olds out there?
Aspiring to be healthcare workers?
It makes no difference. Enjoy. 20s, you're adults, you get to do everything you can. You're able-bodied, you're going to be in the best shape, hopefully body and mind, that you'll ever be. Make your mistakes. As I tell folks, fall. Try to run faster than you can. You're going to fall. You'll be able to pick yourself up. By the time you're in your 30s, you'll be running really well, because you've fallen many times when you were in your 20s. By the time you're in your 40s, everyone's going to be trying to catch up to you. And by the time you're in your 40s and 50s, you're making the difference. You're the Secretary of Health and Human Services. You're the head of that hospital. You're the lead physician in an emergency room. But you won't get there when you're in your 40s and 50s unless you do it right in your 20s. And in your 20s, do your studies, get out of medical school and all the rest, but love life. And that's what people forget to do, is love life. Because you are in a place where more than 99% of humanity will never be on the verge of being a physician, if you think about it. Yeah.
That was deep.
Pretty deep.
That means a lot, actually. Wow.
What has the Biden-Harris administration been doing to address disparities and reach underserved communities? Is there anything you're particularly proud of in your health equity work?
Yeah. When I was Attorney General here in California, we established, for privacy, because the whole thing on social media, tech, everything was, you were losing your privacy. You were giving up information, and your data was being used all sorts of ways to make money, but also to disclose who you were in very personal, private ways. So we enacted something, because of the laws in California, that we call privacy by design. So we made sure that when tech companies try to collect your data, they had to show us how they were going to protect your privacy in the process of collecting your data. And if they couldn't show that in the design of their algorithms and all the rest, then we wouldn't approve them. I took that I learned as AG in California, and I applied it as Secretary of Health and Human Services, and I said, when we do something, and by the way, we're the largest agency supporting healthcare in the world, I said, we're going to have equity by design in everything we do. So when we're going to put out money to a hospital, or we're going to put money out for new students for medicine, we want to see that you took into account equity in the proposal that you're submitting to get our taxpayer money. So that means you have to make sure that the people you're looking for look like America. That means that the people who are graduating can speak in Spanish and other languages, not just in English. That means that the people who are going to be the professionals are working not just in Beverly Hills, but in East LA and Compton and Watts. And so equity by design is in everything we do at HHS. Other thing I'm very proud of is we're trying to direct our resources to grow the workforce like you. And so my son-in-law is now a pediatrician. He went through a program where he got his 4 years of medical school. Are you guys doing okay financially in terms of your medical school?
We're pretty blessed. We were lucky. We got a full ride scholarship. Both of us did. So
perfect. Yeah, my son-in-law. He wasn't my son-in-law then, but he got into a program called the National Public Health Service Corps. And the National Public Health Service Corps says, I'll pay your 4 years of medical school, but you got to give me 5 years of service in an underserved community once you're a physician. So today he's a pediatrician in Salinas, California, working mostly with farm worker families. He's paying off his 4 years of medical school that he got from the federal government by giving 5 years of healthcare service. And it's going to go beyond 5 years, but he's got to give at least 5 years. We've got about 20,000 people who are doing that right now throughout the country. And it's mostly people like you. And so I'm very proud of that. We're going to do what we can to make sure that by the time we leave, when you talk healthcare, equity is in the design of everything we do in healthcare.
Absolutely. Thank you. That's important. I mean, honestly, that's really what it is, equity, what it comes down to. Because we are all definitely in different, whether it's like an immigrant family and or someone that doesn't know English, like we're all at different stages of just in this country, right? So we're all not equally in the same, I guess, plane as everyone. So, and we recognize that, like, so speaking to some of these families in Spanish, like I've had patients like literally like touch my hand and like, you know, like, thank you so much, mijo, for just being here, and like I feel so comfortable with you, and it honestly like touches our heart.
Here's what you're gonna get. Here's what you're gonna get, because I get it all the time too. And I'm not a doctor. And by the way, my wife's a doctor. And at one point in her family's life, they lived in a boxcar because they worked in the Fresno area picking crops and so forth, and they didn't have much money. So she had to work her way up. And actually, her 7 siblings, all of them ended up going to college, doing some levels of college. And yeah, and from parents who were farm workers and the rest. But here's what you're gonna get. As you're probably seeing, you're already getting it. They're going to come up to you and say, mijo, estoy rezando por ti esta noche. Le voy a pedir a Dios que te acomiende y que te dé todo lo que necesitas. You're going to get that all the time. And I remember when I first ran for elected office, way back in 1990, I knocked on a door. I had a woman answer. She had her little kids with her. And I said, I'm running for the state assembly, blah, blah, blah. She said, wait a minute. She pulled a little note card, a postcard, and it was a postcard I had sent out saying I'm running for office. I would like your vote. She said, "Ese es tú, no? Is that you, right?" And I said, "Yeah, that's me. She said. And then she, instead of saying, "I'm going to vote for you," she said, "Mijo, quiero que veas, este señor aquí, él fue a Stanford University. Es donde tú vas a ir." And, you know, it wasn't that I was running for office. It was I had gone to college. And she said, "Mijo, you're going to do the same thing. Look at this guy, because that's what you're going to do. Everyone's looking at you and saying, look at these guys, because that's what we want you to do." And know it, because you are now, for so many people, the 99% of America and the 99% of the world that won't get to where you are. You're the path. So get ready.
Yeah.
Hurry up.
I've definitely had that a lot in the emergency department or in the hospital, where someone literally just grabs my hand and tells me that, like, I'm praying for you, like, thank you and everything, and I've left literally in tears, like, going home, like, damn.
Because they don't see people like you taking care of them.
It's just crazy, you know, like, how powerful it is. Like, it's one thing to say, oh, representation matters, and another thing is, like, to see it or feel it, you know. It's
That's
just
equity
like,
by design.
Yeah.
So that's what, and that's where you all come in, because, and that's why I kept saying, bring more, because there's still not enough. And you know this. You don't see enough of the people, your colleagues. They're not like you. Not enough of them.
No, that's our biggest mission: diversify medicine, diversify just the professional workforce in general, make it more black and brown, because that's what we need for our communities,
Yeah.
and stuff.
And I, this is L.A., this is California. When I go to Wisconsin, I still find patients who are Latino, but you don't find physicians. In North Carolina, lots of Latinos in North Carolina, but are there physicians that look like the two of you? Very rarely.
Right.
So we're lucky. We're in L.A. There are more of you here than in other places, but still not enough. That shows you how tough it is in other places. So the more we do here, the more we can make sure it all spreads. But at the end of the day, it's all about making sure everybody has an equal opportunity. It's not like we're giving you something you didn't earn. It's just making sure everybody who tries gets that chance.
How long
So we have about 2 more minutes.
Okay.
If the Secretary, if you have any questions for them.
Yeah, I'd love to know what got you to want to be doctors.
I mean, for me, a big part of it was everything we've been talking about. I grew up with like 2 younger brothers going into with like chronic disease, and I mean they still have that now. But pretty much because of that, like I was in the hospitals a lot with my mom, taking them to the. And every time I was there, like, one, none of the doctors or providers were Latino. And then 2, even though they were providing, like, good care, and I felt like the good care they were providing not only was for my brothers, but it also touched me because I saw the care they had, like, they were getting. And just something about that for me was like, you know what, I want to do that for other families, too. I want to be whatever that they sparked in me and that made me feel good about the care they were providing. I want to do that for other families. And then one day my mom told me, like, damn, it would have meant a lot if like the doctor spoke Spanish to me. It would have made everything so much easier, because she was like going through this tough situation where she didn't know what her kids had, like were they gonna live, like all of these questions, and she couldn't speak to the physician in Spanish, so all of those things were just like, man, I want to be that one day for a family. So
What about you?
Yeah. So for me, I'm the first person to go to college. Obviously, the first doctor is gonna come out. My family too. But growing up, I actually didn't really have access to healthcare. So like me and my family are undocumented, and so we grew up like not really ever seeing a doctor. So we never really saw a doctor, and when we would get sick, like we wouldn't go to the hospital or anything. And that was always like the mentality, right? Like, and then it started getting kind of weird because I would go to school and people would be like, oh, like they would be like a form, and it would be like, oh, like fill it out, and it'd be like, what's your doctor's name? And I'm like, what are you talking about? I was so confused. And it was always so confusing. People would be like, oh, my doctor so and so, my doctor so and so, and I was always so confused that people had like a designated doctor to them.
Yeah.
And then over time, I started realizing, like, I found out what it meant to be undocumented. I found this out when I wanted to apply to a job, and then I realized I didn't have a social security. And then everything kind of started coming together. And I'm like, oh, this is why we never got like access to healthcare. This is why we never saw a doctor. And to this day, like, my parents don't have a doctor. They don't get healthcare. And so this really inspired me to like want to do something about it, and that's kind of where my seed of medicine was started. And then I mean we took off from there, and I guess now we're here, and I love it.
See, your stories are not unique among many of your family and friends, but your stories are unique in the profession of medicine. Most new physicians, black and brown physicians, probably have a story very much like yours. Never had a doctor. Their parents never had a doctor. But for most folks in your profession, it's like, yeah, my parents were doctors. Of course I was going to go into something like this. It's not something that we have had connection to a lot. That's why it's so important you do it. I remember I used to have to translate for my parents when they would be with professionals, and they'd say, ¿Qué dijo? Ayúdame a entender. And here a little kid is trying to interpret what adults are trying to say. You know how dangerous that is in medicine?
Let us know.
And then let me give you another example what happens. Carolina, my wife, who's a OBGYN, she's a high-risk OBGYN. She's a perinatologist. She's going through training. She went through USC, LA County USC. there would be colleagues of hers when she was already a resident who'd say, Dr. Reyes, please come here, we need your help. You know, physician, okay, she goes over there to help a colleague. Can you translate and tell me what they're asking? So here, the woman who's trained 4 years at Stanford University undergrad, 4 years at Harvard Medical School, her internship, now her residency, her colleagues were calling her over to do translation. Not to do medicine, but to do translation, because they couldn't do it. So they look for somebody. Who do they look for? The person they knew best. It's good that they asked her, but it's kind of shameful that you're asking someone who's your peer, who's trained like you are, to do interpretation, because the hospital wasn't ready to have someone interpret. And so here she is doing interpretation, which she did gladly. But you know, you're a physician. Respect that I'm a physician. Get somebody, have people on your staff who could do what I could do, which is I could speak to this person. And so that's where, when you're there, no one's going to have to say, we need somebody to help you interpret what this patient is saying. Big deal. You're gonna have all those people holding your hand, saying praise for you. So
Thank you.
Guys, we really
Yeah,
have to wrap.
appreciate it.
Gotta wrap.
Definitely. Thank you, Secretary Becerra. I appreciate the time, and honestly,
No,
this
no.
conversation was really
I am.
meaningful for us.
Yeah.
Hopefully, you can watch this back on our blog,
Yeah.
and hopefully you like it. You know, and so I hope all
Give
you
me
guys
some
out
likes.
there. Yeah, make sure you guys like, comment, anything you found inspirational from this content. This video, this conversation, we really enjoyed it, but the day's gonna keep going. So I know you have a busy day, so we'll let you go.
Amen.
Yeah.
Thank you. Succeed.